You're listening to The Pulse on AMI Audio. I'm Grant Hardy. A new report by Community Living Ontario details the disturbing treatment of students with disabilities in Ontario schools. This treatment includes exclusion, seclusion, and restraint of the students. The report is titled Crisis in the Classroom. It provides an analysis of the Ontario School Inclusion Survey. And here to lay some of the findings out for us is Shawn Pegg, the author and the director of social policy and strategic initiatives at Community Living Ontario. And Shawn, I really appreciate your time today. Welcome to The Pulse.
Thanks, Grant. Thanks for having me here.
So let's start by talking about Community Living Ontario. If you don't mind just sharing a little bit about the organization and your role.
Sure. So Community Living Ontario has been around since about 1954. It was started by parents of people labeled with intellectual disability who worked throughout the 1950s, 60s, 70s, 80s, 90s to ensure that their children had access to the same things that all children are supposed to have access to and have a right to. Things like, living in the community, being able to stay at home with their families. And over the years, Community Living Ontario has grown and professionalized. And in the current day, we are still very much guided and directed by families. I would say the organization is increasingly informed and guided by people labeled with intellectual disability themselves. And we also have very close connections to developmental service agencies in Ontario. And we work to influence the practice of developmental service agencies and other, health and social care providers so that people labeled with intellectual disability are able to live quality lives in community where they make the decisions and choices in their lives that follow their own desires, their own wishes for their lives.
And that mission obviously is, the same nowadays as when the organization, was created. Would you say that over time, like to think we're at least trending in a positive direction just in general over time? Do you think that's accurate?
I do think that we are light years ahead of where we were even in the 1980s. The last large institution for people with disabilities was closed in, I think it was 1996. There's still obviously a long way to go. People labeled in this way face huge amounts of bias, stereotyping, discrimination. People still lack access to appropriate education. The unemployment rate among people with labeled intellectual disability is still incredibly high. So no doubt there is a lot more to do. But certainly when compared to when we started in the 1950s, things are a lot different and much, much better.
School and public education is definitely complicated when it comes to students with disabilities, special needs. And we're talking today about your new report, Crisis in the Classroom: Exclusion, Seclusion, and Restraint of Students with Disabilities. This was based on an analysis of the Ontario School Inclusion Survey. Can you talk a little bit about what led to this survey and how it was conducted?
Absolutely. So a few years ago, the Ministry of Education, this is going to be a little bit boring for a short period of time, my answer to this question. So the Ministry of Education did a review of something called Caring and Safe Schools, which is a policy document that looks at how schools address, unwanted, let's say, behavior on the part of all kinds of students. It's not limited to students with disabilities. And, this is a very problematic document because in many cases it places the onus of, externalizing or challenging or whatever you want to call them behaviors on students themselves. And I think it really fails to look at the school environment as the cause of problematic behavior amongst all kinds of students. Um, and that review process kind of crystallized things for me a little bit because, in my opinion, Caring and Safe Schools as a document is incredibly flawed and way overdue to be replaced. And we get calls from parents on a pretty regular basis because they have hit a dead end in terms of getting a proper education for their child.
Mhm.
And we support a small number, but it's still a significant number of parents going through these situations. So I had seen students and parents who had experienced being excluded from school, being restrained in school, being put in seclusion rooms. And I had also seen, very strong work from other folks across the province, especially in BC, who have really been leaders on this. Inclusion British Columbia has really talked a lot about restraint and seclusion. And, I saw that some work had been done in Ontario, but nothing that really moved the needle or got a lot of attention. And for me, these are issues that are screaming out for attention. And I really wanted to do something to focus efforts around reducing these really problematic things that are happening right across the province.
Public school is definitely kind of a one speed treadmill, I think, sometimes, and certain behaviors are just treated exactly the same, whether they are done by somebody who is genuinely being manipulative versus somebody who, maybe didn't have a healthy lunch beforehand or whatever's going on at home. Do you think that some of this work that you're doing, you know, perhaps we can create a more inclusive environment for all students, including special needs, by just bringing a little bit more understanding here?
Yeah, I would definitely agree with that. Um, I think that teachers and other school staff are kind of doing the best they can
Yeah.
under
Mhm.
what are sometimes difficult circumstances. I would also say, if I look at what parents were telling us through the
Mhm.
survey, a lot of parents talked about being in a good situation in a particular classroom or with a particular principal, and then losing a really important classroom teacher or an EA or a principal, and things changing just so quickly because of a lack of training, a lack of knowledge on the part of the new staff who had come in. So the difference from one school staff to another can be the difference in, the quality of a student's life for 7, 8 hours a day, which is huge. And I think those kind of changes speak to the need for training and, like you said, more insight into where what many call, and I like this term, externalizing behaviors, where those
Mhm.
externalizing behaviors are coming from. The term is so accurate because the outside behavior might be challenging or what have you, but I think if you understand that that's a student who is communicating something and they're having strong emotions and are having a hard time communicating that in a more appropriate way, I think it goes a long way to informing the response. And so that the response is appropriate and works to address the underlying factors instead of, what you're seeing right in front of you at the time.
Absolutely. So, as you mentioned, there are a few recurring themes here. 29% of respondents, which is a huge number, have experienced being isolated behind locked or blocked doors, often very repeatedly. What, uh, why is this being done, and what effects does this have on the kids and the community?
In terms of why it's being done, that's such a difficult question. I think it does vary, um, but clearly there is, I'm, I the the situations are so different from
Mhm.
person to person. But, just to answer your second question first,
Yeah.
I think in terms of restraint, and, I've heard of young adults, like 15, 16, 17 years old, who have become overwhelmed in the classroom and just need some time away on their own. And these are students who might come to school on their own, go home on their own, they're out in the community independently, but for some reason they try to leave the classroom and they're being like literally tackled and wrestled to the
Mhm.
ground by one or two staff. And that kind of situation is traumatic for everyone involved. It's traumatic for the student, it's traumatic for the staff who are doing it. With seclusion, same thing. Being forcibly put into a locked room, sometimes a padded room, like that has impacts that can last months and years, emotional impacts. So the influence can't be understated. And in terms of why it's happening, schools to start with, schools can be very stressful, anxiety producing places for a lot of students, especially those with, who are, have environmental sensitivities. And, students with disabilities in particular are at pretty high risk of facing bullying, harassment, discrimination from other students, for example. So you can see how these things can build up over the course of a day. And, I think what we heard over and over again is that there isn't enough support in classrooms for teachers. There aren't enough educational assistants, for example. A lot of the other services and supports that students need, things like occupational therapy, physical therapy, speech language therapy, kids are waiting more than a year just to be assessed for these things. And so, they're struggling with impairments that they don't have support to get help with. And then, it leads to the situation where kids are kind of reached their limit, and then teachers and other school staff aren't in a position to react in a thoughtful, informed, appropriate way when externalizing behavior does happen.
I'd imagine that being restrained is a very like instinctual kind of thing. I would honestly doubt whether it feels much different being a kid on a playground doing it to you or an adult, your teacher doing it to you. It probably feels like a lack of control over your body either way. So curious about a solution to the physical restraint or just isolation. It seems like more support is needed is basically the solution, right? More intervention, faster intervention, more EAs, more training for all educators. Is that pretty much the recommended solution for these particular issues, or are there other things that can be done?
I think, yeah, absolutely. Having more support in the classroom is very important. Having more training for school staff is incredibly important. Um, it's a little surprising. I had to like triple check this with folks who are more knowledgeable than me. There is no provincial guidance on restraint or
Mm,
or seclusion. So school boards are being left to their own devices to create their own policies. And if you look at some of these policies, like they're very different from board to board. So the experience of students and school staff are very different from board to board. And you even see differences from school to school because principals have different perspectives on this. So I think we're way past due to have provincial regulation and provincial policy on restraint and exclusion and more broad ranging provincial policy on school exclusions and partial day attendance. And I think if you have informed provincial guidance, more support in classrooms, more training for teachers, and with a focus overall on prevention, so you don't get to a place where a teacher feels like it's necessary to physically intervene. I think those three, four things would go a long way to addressing these problems.
Let's talk about communication as well. Something highlighted in the report is that often parents, guardians, they're not finding out about these even incidences of restraint happening at school. They may actually learn from their own child. This is kind of mind boggling if you just put a mainstream student into that. Does not seem like something that society would just accept if this was common outside of the disability community. What do you think should be done about this in terms of standardizing that reporting and communication?
For me, any policy around um, restraint and seclusion would need to include informing parents, caregivers, guardians. That is an important piece of it. Like if you think about students who don't use words to communicate, like I've heard directly several instances of kids who don't use spoken language,
Mhm.
and they've been restrained or secluded, and that the school didn't inform the parent, so the parent found out from like another student or
Mhm.
another parent, which is just, to me, that's such a scary situation. So yes, I think every instance of restraint and seclusion needs to be documented. It needs to be communicated to caregivers. It needs to be reported to the board level, and there needs to be reporting provincially about this. Like the fact that there are padded rooms that you can lock from the outside and not leave from the inside, like honestly, it kind of blows my mind that this is happening. So like what about like I feel like schools should be required to report on whether or not these things exist in their school. Like, yes, we do have a room. The walls are padded. The
Mhm.
door can be locked, and this is how many times we've placed a student in there in the past year. That seems like a basic thing that we should know.
Yeah, I think the combination of the inconsistency, informality of policies versus lack of communication is really what should ultimately be terrifying unless they're addressed. We've talked a little bit about excluding people entirely from the school day, partial attendance, asking people to go home. 31% of your respondents said they've experienced this. This is something that I wouldn't be surprised if a student with a disability who hasn't experienced it yet probably will in the future. Can you give an idea of just how, I guess, again, if there's anything you'd like to add in terms of what could be done about it, but also just how pervasive the reasons are for doing it.
Sure. Yeah, I mean, I think that the shortage of educational assistance is the key problem here. When we released the report a couple weeks ago, I was joined by Liz Garkowski from Ontario Parents for Education Support, and this group has done an incredible amount of work on bringing attention to reduced EA numbers in schools
Mhm.
and how their kids have, in many cases, gone backwards because of the lost support. Um, so when it comes to addressing exclusions, that is probably the most important one. Many parents and other advocates are also, calling for increased reporting on school exclusions. There's no real way to know how many students have been informally excluded from their school. So, there's a process for tracking formal exclusions. There's a process for tracking suspensions. But if a
Mhm.
principal, calls the parent at noon and asks them to come pick their child up, or if they send an email in the morning saying, I'm not sure we have enough staff this morning, those things are just not tracked. They're not able to be separated. So it's this combination of being able to track it and then reporting it publicly that I think will bring some accountability to the process. I'm sure that there's more, and there are others who are more expert on this than me, but those are a couple of the key issues that have to change, I think.
So we have already talked about violent incidents, but I just had a question here, so figured I'd throw it out in case you'd like to cover basically how should we frame violent incidents at school? They do happen. There are injuries at school. The report did talk about it. It did talk about how there is really sort of an overemphasis in the media on people, quote, with disabilities committing violent incidents, when maybe it should be framed a different way. We talked a little bit about not externalizing those incidents, but I guess, how do we view violent incidents in school? How do we de-escalate them respectfully and with dignity for everyone?
If we're talking specifically about students who have developmental disabilities, um, I mean, it's such a complex topic,
Maybe
and I
all.
just try to avoid at all costs,
Mhm,
even actually words like violence or aggression,
mhm.
because I think it can get into stereotype a little bit. And if I look at some of the reports that have been put out by organizations like Elementary Teachers Federation of Ontario, Secondary School Teachers Federation of Ontario, I think they've been really good at contextualizing, externalizing disruptive, challenging behavior among students with disabilities as communication. I think it first and foremost has to be understood as communication that something isn't right. And in the school environment, there hasn't been enough focus on preventing the student from getting to that place. I've lost track of your question here, Grant. What
No,
was?
yeah, I think that's a good way of a good way of framing it is just preventing whatever systematic barriers in school are causing poor or perhaps physical aggressive communication, when maybe that's not anybody's intent, and that could be just more staff, more support, more training, rather than just labeling students as violent, quote unquote. Is that kind of a fair picture there?
Yeah, yeah, and I think in the report we note how even reporting with the best intentions, there's like a reflex to blame students,
Yeah.
which is not getting to the source of the problem, and it's not going to help you solve the problem.
These issues seem to be fairly consistent across the country. These isolation, exclusion, restraint issues. How are other provinces doing?
Honestly, not much better. We've had reports in BC, Alberta, Manitoba, and Quebec, and they all show very similar things. And strangely, I think good thing we've seen in BC is the Provincial Ministry of Education published guidance on restraint and seclusion. So it wasn't demanding change from school boards, but it was putting guidance out there on how they could create their own policies following these kind of guides, which would at least create some semblance of consistency across the province. So that is one positive thing,
Mhm.
but it's odd how much we've seen provincial ministries of education resist addressing these problems, which I don't completely understand. Yeah, I don't know what's at the bottom of that.
What are your dreams for the future? If you look at the next, 5 years, 10 years in the education system, what do you think we can accomplish, or where could we be if we put in the right effort, the right resources, the right training?
If I think about the mission of Community Living Ontario and the approach of our organization and the community living movement, we really see communities as having most of the tools needed for inclusion and belonging of all people, including people labeled with intellectual disability. And the classroom is no different. You know, we see examples of success when teachers and other staff look to the whole classroom as supporting each other. You know, all students understanding each other, all students supporting each other, and creating like an ecosystem, a classroom ecosystem where all students are, pretty well understood and having their needs met not only by school staff, but they're being supported by their students. Like I think about a student with, like a kindergarten student or
Mhm.
grade one student with physical disabilities who might not have the ability to tie their own shoelaces or do up their own
Mhm.
coat. And I picture not in a charitable way, but in a self universal supporting way, not needing a teacher or an EA to help them do up their coat. I picture other students helping them with things like that. And I think if you look at classrooms in this way as like a supportive ecosystem, it sounds a bit Pollyanna. However, we've seen examples of where this does happen, and where the classroom isn't seen as, having students on one side and then staff on the other, and the staff have to do all the things to support all the students. But it's more of you know, a, a complete learning environment where everyone is supporting each other. That's kind of the vision that we have over the long term.
The classroom is just such an essential way of building those skills and fostering a real acceptance of inclusion and accessibility for kids of all abilities. Really important work that you're here doing here. Where can people learn more? Maybe check out the report and get in touch.
Yeah, so our website is communitylivingontario.ca, and you can find the report there on our advocacy page. And we also have, for parents and caregivers, a complete guide on special education system in Ontario for parents who are coming up against these issues. It kind of walks you through the whole process for what to do in various situations.
That's going to be really helpful. And Shawn, I really appreciate your work that you folks are doing, and thank you for taking the time to join us on the Pulse.
Thank you, Grant.
That was Shawn Pegg, the Director of Social Policy and Strategic Initiatives at Community Living Ontario. The Pulse airs on Tuesdays and Thursdays at 1:30 p.m. Eastern and repeats every 6 hours. You can also find The Pulse on YouTube or wherever you get your podcasts. I'm Grant Hardy. Thanks so much for listening.